Якщо мене чути добре, то ми будемо починати. Буде невеличка екскурсія і пояснення, як все буде відбуватися і чому такий проєкт взагалі виник. Ми перейдемо до презентації. Так, друзі, наш проєкт називається Healthcare
Forum Transformation, htf.org.ua. We will take a look what is going on. Our first project, this forum is a platform for communication. It's not a standalone event, but a platform to share knowledge, information, and practice useful to all those involved in medical sphere reform. First project is the medical guarantees project of 1 year work period. We estimate that this project will have 1 year. We will have series of national forums, and after that will be another one. We have some resolution events, so-called update, 1 month, 3 months, 6 months, 9 months, and 1 year. I hope that in 6 months or 1 year we shall meet offline. Let's go. This is our logo that urges us to be discreet with the first year of medical guarantees reform. Our objective is to monitor the efficacy and the quality of the healthcare system transformation in the first year of medical guarantees program introduction on all the levels of medical services. Project format, series of national forums with international input, both online and offline, intermediary panel session and webinars between forums with experts and stakeholders. You see in yellow highlight what we need, dialogue fostering and consensus facilitations on all levels, medical care managing potential enhancement and participants' competence improvement, common motivational ground creation. Unfortunately, this has not been achieved yet, and preparation of the relevant documentation elaborated after forum discussions with expert opinions and stakeholders, with recommendations to move forward and to implement national policy in medical healthcare field. So we have the first event, 1 year, 1 month, 19-20 May. We will have 2 halls, National Hall, where we are now. Accordingly, right now I will we have National Hall where we are now. On site htf.org.ua you will have free access through Zoom or browser. Depending on which hall you want to visit, you should use a different link. Local hall will start its work a little bit later from 11 a.m. First year of work and the first event. We have the first unit, takeaway of the first month of the program of medical guarantees. We have invited everyone. We try to make it as open as possible. From 10 till 11 we will have it, the presentation. We have got the agreement with the National Service of Healthcare System, WHO, USAID. The President's Office response suggested a very tight agenda. Accordingly, this is all our answers, but we invited everyone. Unit 2 will cover special topics from 11 till 19 p.m. You see what topics we shall discuss. You have the program. In parallel, starting from 11 a.m., there will be Unit 3 from 11 till 19. There will be the presentation and discussion panels together with an experts. Unit 4, International Experts and Consulting, will be on May 20, starting from 9 a.m. There will be a lot of international experts, interesting topics. They are not listed here because many people wish to join our forum and we included them in our program. Accordingly, starting from 12:30 tomorrow, Unit 5, first month in Program of Medical Guarantees. We wanted to make sure that each level of medical aid share their stories of success and failures. Heads of all medical institutions will talk, and primary medical aid, secondary medical aid, urgent medical aid, and our most weak spot, specialized medical institutions for long-term treatment. And we will share our experience, practice, success and failures. In parallel, in local hall, we will have the presentation of the functional opportunities of medical information system. So you can, at least 6 informational systems are ready to participate tomorrow. We have a lot of experts for this forum. You see all of them. You will get to know them later. Site htf.org.ua. It's a public page. You may join it from this platform, joining one of the links, national hall or local hall. You may enter one hall and exit the other. It has free access through Zoom or through browser. No password is needed. We have an online translation, national hall on YouTube channel. You choose this link and you may share this link with your colleagues so they can join our discussion. On Facebook page, there will be the translation of the local hall. You may also download our program. It is quite ambitious. Please download it and you will know and join when and where you want when you are interested. We didn't expect, we bit off more than we could chew. Apologies for some technical problems, overlaps. We are trying new technologies. More than 40 national speakers and 11 international speakers are going to speak. Accordingly, more than 500 attendees joined us, but it will be very interesting. You can join on this site and join our platform, fill in the application form to join all the forums, so you don't have to register for each event. You will get online notification automatically and some recommendations. Please fill it. What else? You may find is a reference link on the questionnaire. Questions to experts and participants on transformation. They are grouped according to different spheres. You choose, you tick it, and you make your questions. We have some addendum, and the experts have a free access to this questionnaire. You may correct their work as well. Currently, the most interesting and topical issue is cooperation with the national healthcare system and informational technologies in the medical sphere. And informational medical system and e-health. It is obvious and easy to understand. This is the division according to the region and the profile of those who ask questions and what kind of question they ask. So please write us and connect with us. Of course, without partners and support, such event couldn't take place, and I am very grateful to the Embassy of Netherlands in Kiev. They are supporting our initiatives many times. They are facilitating it. The national healthcare system of Netherlands is one of the strongest in the world, so we involve their experts. Right now, I will try to move forward. On the screen, attendees, you have a similar screen right now. You see that you have, we will have international speakers, so you should see the globe. You choose one of the globes and you can, when the speaker speaks English, you choose, if you're Ukrainian speaking citizen, you choose Russian, and currently you are on this channel, so you will hear the translation, and you may turn off the original sound, so you will hear only the translation, and you will not hear the speaker. Our international speakers, if they want to hear their questions, they will choose English channel. We have the chat. My apologies, but there should be a moderator in the chat, but we don't have enough workers, so I will not be able to moderate this chat online. There is other option, questions and answers. You may ask some questions, and if we manage to organize everything, maybe tomorrow the experts may be able to see these questions and answer them personally or in public in these questions answers. There is another option, very interesting, raise your hand. You as attendees, later we will try to repair this so that I can react, and if you want to raise your hand, we can give you the word, we will turn on the sound, and you can ask your question to the expert, or you may become a speaker. You will turn on video and you can show something with the rights of the speaker. Such options exist, and you should understand our course, so it can be a very nice option of offline. You see our experts. Just a second, I will try to look through those who join us already. We have Jarno Habicht, the representative of the World Health Organization in Ukraine.
Да, Jarno, будь ласка.
Good morning, everybody, and it's nice to be connected. And I understand from also the introduction that we have colleagues across the whole country, but then also various experts, and also international experts, national experts. And I'd like to welcome you, everybody, for this first two-day meeting. And then we can follow up also as the year goes on. So maybe I will say a few words in the beginning, and I like to thank also my colleagues in WHO, Elina, and others who have been preparing a very good slide set for me. But I decided not to use the slides, and but to say a few words. And as I have been WHO representative in Ukraine soon 2 years, it has been exciting times to see how the reforms are unfolding, and also all of us together to do some thinking how the things are going further. So today, as we are talking about the benefit package and how we will move on with the state guaranteed benefit package, is also to look back and from where we started, what are the plans for future, and connect these two dots. So when I look back, then around the last 5 years ago, we have been starting this reform path in Ukraine. And for the World Health Organization, it's a very important to see how Ukraine is progressing. It has been discussed for a long time, and we see that the agreement was there in the last 5 years ago to move forward, to think about the benefit package, which emphasizes equity and human rights, but look also how we can pool the funding and also create a single purchasing agency. So that has created the basis for the National Health Service of Ukraine. That has been basis for thinking about the medical guarantees, but also looking beyond and looking to the affordable medicines. And also a number of other changes happened in the past years, some of those related to the medical education, some of those related to actually having clearer role for the primary health care. So it has been exciting times, but also we understand that as the reforms are going further and what we have seen in other countries, the reforms become much more complex as we are moving forward. So in 2019, we had a mission together with the World Bank and WHO, and we thought we need to review what is the situation, what we have learned from the last 3-4 years and how to move forward. So many of you know this publication, which is available in English and Ukrainian, about a review on health financing reforms, 2016 and 19. And I just want to recall that if you have if you don't have any other plans for the weekend to read, then that's a good report to go through and look, because many of the ideas and recommendations in that report are the ones that we could also follow up today. So I will not go through all of them, but that was kind of stock-taking moment for us to look back, see what needs to be adjusted, and then think also further. Because in the first round of reforms, we were looking really on financing and the primary care. And now, as we are 1 month from 1st of April, we are looking more on the specialized care, hospitals, etc. So what we see is that if you think about the iceberg, then if you see the top of the iceberg, this is something that we have really done, but there is a lot of work that is still to be done in the coming years to deliver better quality and equitable services to everybody. So the key message when we look back is that health financing reforms were necessary as a precondition for overall health system change and ignite that change. But what we also know that it is not sufficient for transformational change for all the clinical practice, managerial practice, and everything I understand we will discuss also today and tomorrow on the Healthcare Transformation Forum and in the coming meetings as they come further. So now the key question is, when we look further, what are the other things to happen and what needs to change? Because there are many extra steps that need to be taken beyond the health financing. So one is very important, what in the coming years, from our perspective, is to develop and implement well-thought service delivery reconfiguration plan. And what I mean is that we more clearly define what are the roles of the hospitals, what are the roles of the outpatient care, look also how to the efficiency and the quality. So that is very, very important, because if we want to deliver well-designed, state-guaranteed benefit package, it's not only about the financing, it is also how the service delivery system is reshaping. Another big area where many of us around this conference have been discussing in the past is what about the medical health workforce and medical education. In 2020, as a WHO and the world community, we are celebrating the year of the nurses and midwives. But if we extend it more widely to all workforce, that is something that needs to also be reshaped to actually provide the services. So when we have financing system in place, we need to look more to the service delivery and health workforce who are in the front line to have that system really delivered to people. And another key element, which is very, very important, and I know that we will discuss that on the second day of this two-day meeting, is about the health information systems and the management systems. Because without the good data, it's very difficult to make decisions. So I think the system in place that can cover all the country, can cover in the systematic way, in the harmonized way, as well that is linked very closely with the National Health Service, helps us to understand what services are provided, to whom, but then also to design the benefit package further. And that's a very important cornerstone that we have not learned from many of the countries where the single purchasers are existing to ensure that the data from public and private providers are regularly provided to the purchaser. That allows us also to adapt as we are moving further for the reforms. And in all of these changes, we shouldn't forget also to continue the health financing reforms and strengthen the purchaser. So what I see as a future is that really it is not that we have done financing and now we look to next steps. I think we need to continue in all of those tracks. We need to continue on health financing reforms. We need to continue on the service delivery reforms. We need to look how the medicines are more affordable to people as well. We need to monitor regularly if the things are going in the right direction. So putting them all together, we need to think why we started those reforms or why Ukraine started those reforms and why we came all of us together to decide that this is a good investment to do. Is that in our analysis, we see that more than 1 million people fall into the poverty and have financial hardships because they need to pay for healthcare. So we want to actually ensure that the vulnerable are also protected and nobody is left behind. So we do those reforms not because of only reforms. These reforms in the health sector are there really for people to ensure that the good quality and affordable services and medicines are available for everybody. And I like to thank at the end also, as we are going through the COVID outbreak, everybody around the conference who are working hard here and there to support also the response, because that's very, very important. And thank you all, and especially the healthcare workers who are in the front line and who are supporting everybody who needs the support. So these were the few thoughts for the starter. I think it's wonderful to have kind of regular discussions and to learn. And I think it's not only during the first year, but actually what is important that we regularly learn how the system evolves. These type of discussions need to take place, but also we need to adapt the system as it is moving forward. So healthcare system and health systems are living organisms which are learning all the time and adapting as well. So thank you for the opportunity to share a few thoughts. Thank you also convening this type of discussions on health systems at the time when we have so many other priorities, because it is important that while we are going through the outbreaks and crises, we also continuously develop health systems, and that's very, very welcome. And I hope that Ukraine reforms from the first phase, but as well the second phase, become something that everybody can learn. And from WHO side, we are very much supportive to next phases. Thank you. Over.
Дякую, Jarno.